in the operating room here with Betsy, and we're getting ready to do lipo control, the GPS lipo on her abdomen. So we've marked her, and she has had a few pills to relax, and we're going to make a little poke right here and start putting the numbing fluid in. So you're going to feel a little uncomfortable as this fluid goes in your abdomen. This is lidocaine to numb the tissue. How you doing there?
Hi.
So right now we're setting up the laser fiber and pushing it through the little port that we're going to use to insert into her skin. White cord now. This is the GPS device, the tracking device that's being connected to the machine. It goes into the back of the cannula or probe to monitor my hand movement. Okay, we finished numbing Betsy's abdomen, and we're now ready to do the lipo control, the GPS lipo part of the procedure. This is the laser probe. There's a little red light here. This is the GPS camera that's positioned over her abdomen, and the little red light tells us that the camera's on. And the screen, we're getting ready to calibrate the laser, and we're going to make a circle on her abdomen where we're going to be doing the lasering. So we're mapping out the data for the GPS system right now. So now we have a circle drawn of the half of her abdomen, and we put the laser probe underneath the skin into the fatty layer, and then I'm going to activate the laser so you'll hear a beeping sound. Now we've got the laser in, and it starts out with kind of a blue color, and we're going across the area just kind of like you're coloring. And the camera head is following where the movement of my hand is. And the color screen is monitoring where the laser energy is being applied. And it'll begin to change colors as more energy is applied to each area. If you just stay in the same area like this, it begins to turn red, then yellow, and then eventually gray. Okay, now we've just done the top area, a small area of her upper abdomen, and you can see the screen on the top right that it's gray. It's flashing gray, indicating that that area is done. You can see the rest of the screen down at the bottom here has not been done, and it's still blue and some pink. Now, one of the safety mechanisms of this machine is that if you stop moving your hand and just hold still, you'll notice the laser turns off and you see the color has not changed. So if you just forget and hold on to the laser, it allows you not to burn the patient, because the laser, you hear the sound firing, but it's actually not producing any energy in that area.